by the email.
I did hear that Health Imperatives is doing really well with their clinic right now. It's been busy and active, so that's awesome.
I'm really happy to hear about that. And then we're going to be starting tomorrow with some business focused clinics. So getting people some free time to get away from work and then just getting everybody all done in one like solid chunk should help the people that are on the fence or unable for a while.
Janine said she's not going to be able to be here because she's traveling in the midst of traveling back to the island. So
All good. Kevin, do you have your agenda?
I do, but I cannot, because I'm on my phone, I can only see one person at a time. So I can't tell how many people are on.
Oh, we've got 20 on so far.
Okay. We'll give it one more minute and then we'll start because I know it's 12:03. So again, I can't see who's on, but do you want to do the introductions?
Just have everybody go around?
Yeah.
Sure,
And then
sure. And I'll do it by calling by my screen order. So Ms. Sue Gamby, you're up first.
all right, Sue Gamby, and I'm with ASAP and NAMI and wherever else anyone needs me.
Thank you. I guess I should go. I'm Sue Mintonen. I'm the director of addiction and substance misuse prevention programs for NAMI on Nantucket. Jackie?
Jackie Lane, Executive Director of NAMI Cape Cod and the Islands, including on Nantucket.
Kevin? Kevin, do you want to say who you are?
Hi, Kevin Marshall from Nantucket Police Department and the chair of the advisory group.
Amanda?
Hi, everybody. I'm Amanda. I'm the clinical director at Fairwinds.
Tess? Nice to see you.
I had to unmute myself. I'm in private practice on Nantucket. Hi.
Erin?
Hi, Erin Russell, outpatient director, Nantucket.
And Sherry?
Hi, Sherry Hunt, Director of Elder Services in Nantucket.
Greg?
Hi, I'm Greg Belomo. I'll be working on a behavioral health assessment of the island, and my colleagues Laura and Nancy are on the line. And so we are going to be, I think, a fair portion of your agenda today.
Definitely.
Awesome. Jericho?
Jericho Mealy, Town of Nantucket, Department of Human Services.
Carrie?
I'm Carrie Bridges. I'm the Director of Communications and Community Engagement with A Safe Place.
Laura?
Yeah, I'm Laura Sigrist. I'm here with my friends Greg Belomo and Nancy Vandermark to talk about the behavioral health assessment. Thanks for having us today.
Great. Nancy? Want to echo your colleagues?
Yeah, I'm Nancy Vandermark, same, working with GPS on the behavioral health assessment.
Awesome. Ben?
I'm Ben. I'm a private citizen here, a relative of someone in many of the organizations here, and past background in social work and psych counseling.
Thank you. Margaretta?
Margaretta Andrews, Community Foundation for Nantucket.
Michael?
Hi, Michael Kellerman, Interim Executive Director at Fairwinds.
Rachel?
Good afternoon, Rachel Day, Assistant Town Manager with the Town of Nantucket.
Brooke?
Hi, everybody. Brooke Moore, background in social work, currently chair of the Council for Human Services. And I also am vice chair of the Affordable Housing Trust. So I have a lot of interest in this subject. Thanks.
Heather.
Hi, Heather Haddon, member of the recovery community and of ISAP.
Thank you. Holly?
Sorry. Hi, I'm Holly McGowan, and I'm on the NAMI ASAP Advisory Board and Steering Committee for the GPS Health Initiative for Nantucket, and the parent of an addicted loved one.
And last but not least, Deborah.
Hi, everyone. I'm Deb Gately. I'm the Director of Special Services for Nantucket Public Schools.
I should have added with mine that I lost my son when he was, one of my sons, when he was 24 to an accidental heroin overdose. It was fentanyl, but so that was 3 years ago. So again, this is very near and dear to my heart with regard to doing whatever can be done for education purposes, counseling people that come to me and just want to talk about it. And so I'm thankful to be a part of this group as well.
Thank you, Sue. Kevin, back to you.
Excellent. Thank you. I want to thank everyone for attending this meeting. I do want to thank Sue Gamby, for sharing that, but also she's been doing a lot of volunteer work, making sure that specific businesses and organizations receive our signs. And so I wanted to make sure that she was acknowledged for that. She's doing a lot of work and we appreciate that.
Thank you, Kevin.
I want to apologize because I am at a mandatory in-service training. So if I do not look professional for this meeting, that's why. But I am very excited to report that May is Mental Health Awareness Month, and that this organization, committee, and volunteers are moving great speed forward in order to accomplish a lot of wonderful things. A couple of the things that we are doing, first of all, the select board accepted the proclamation last night, and I was able to read it aloud. I thanked them, and I will thank them again for always looking to help us in any way possible, whether it be financial or looking for a way to accomplish whatever it is that we're trying to do. So if you see a select board member, make sure that you thank them. So that was the proclamation. It was suggested that we use social media, i.e. our Facebook page, to acknowledge Mental Health Awareness Month. So I did in fact go on and change my profile picture. I encourage anyone on Facebook to go ahead and do that. Suzanne and I are working on having a table at Stop and Shop, which has been approved. It is not going to be a manned table due to COVID, but it will be an informational table that people can go up at their leisure and take pamphlets and other items that will be on it. I will be setting that up this weekend at some point, and it will be up for about a week or two, probably 2 weeks. They're really giving me the leeway on doing what I want to do, actually. So it will only be at the Mid-Island Stop and Shop. There's just not enough room at the downtown Stop and Shop to do anything. So that will be taking effect. If you are affiliated with an organization that wants to have some type of pamphlet or brochure, obviously space is limited, but we want to make sure that we represent all the organizations to make sure that we're providing as much information as we can. We have approval from Rob McNeil to advertise at the dump. He's granted us permission to print out 2 banner size posters, which will be the same thing that we have already begun to pass out. Hopefully, if you're driving around Nantucket, you have seen several yard signs that acknowledge the behavioral health advisory group, and it has the barcode that people can scan, reminding people that mental health is okay and that there is help on the island. If you want one of these yard signs, which I am going to put in my yard as well, make sure that you reach out to either Sue, Suzanne, or I, and we'll make sure that you receive one. What else? There is the suicide awareness walk that we have yet to create a team. So at this point, I would say if you're interested in representing Nantucket on that walk, to reach out to Jackie, who's the woman? Kim Walter Meads?
Kim Mead Walters.
That was close.
Sharing kindness.
If you go to our website, the ackbhtf.net website, I've advertised that on there. Also of which we have updated that website, and I continue to receive emails from organizations asking to have their link updated. And so continue to do that. If you want to venture on the website and you see things that are not correct, make sure you let me know and I will be glad to update that.
Kevin, what's the date for the walk?
22nd.
Of May.
10 o'clock in Hyannis.
Yeah.
At Veterans Park. But you can do it virtually also.
She actually does do a great job of organizing that, and she does raise a pretty good amount of money. So
there are 4 organizations involved in it. Samaritan Suicide Prevention Council, NAMI, and then Sharing Kindness, which is her organization.
Thank you.
So yeah, a lot of exciting things happening this month. I'm very pleased to be a part of it. If you're looking to help us spread the word or pass out any posters or pamphlets or anything like that, reach out to one of the 3 of us. With that said, is Laura on?
I am here. Laura.
Hi, Laura.
Hi, how are you?
Good, nice to see you again. So Laura is from GPS. GPS has been hired to support the Community Behavioral Health Assessment for Nantucket in partnership with the Community Foundation, Fairwinds, NAMI, and the Nantucket Cottage Hospital, reviewing ways all of us and the general community will be able to participate. I know that's a very brief description, but there's a lot of good information that they're collecting, so I'll let her take over and talk about it.
And thank you. And I'm actually going to ask my colleague Greg to start, and we're just grateful for your time today. So Greg.
Thank you. I'd like to share my screen. I wonder if one of you could make me perhaps a co-host.
You should be able to now.
Got it. Yep. Thanks, Sue. All righty. You all are probably looking at my calendar. That is not a pleasant sight. Here we go. Okay. So we actually have several members of our steering committee on the line. So I'd like to ask Jackie, given your role on the task force and your role on the steering committee, if you wouldn't mind just helping everybody with the case for change and how this connects to all of the good work that's been done to date and all the things that are in flight.
This is off the cuff, but I speak off the cuff all the time. So no, this is really exciting and unique, I think. I know even from the 4 or 5 years I've been involved on Nantucket, we have always talked about the lacks and the gaps in our care system, even though there are a lot of great organizations and great people trying to do a lot of things for mental health. And we consider substance misuse part of mental health. So it's one and the same. And we were particularly excited about this whole endeavor because we feel that the timing is right to be really successful at this point. I think some of us are really trying to collaborate and work together in new ways. Also with COVID, I really feel that COVID even raised more awareness to the fact that how fragile we are as far as mental health. Every one of us is fragile. Every one of us can now understand more stress and anxiety, depression, and so forth. The money was there. We had a big donation that part of that money was taken and made into a special fund at the foundation. The foundation agreed to do that. And we have new leadership, relatively new leadership at the hospital. And Gary Shaw's idea is, I think you've probably all heard him say the 3 parts of health: the spirit, the mind, and the body, and as necessary for mental health. So we feel with all of those things that it's a perfect time to hire a professional group, from the outside to really look at our community on the island and to come up with a real assessment that we can all buy into and use as a planning tool going forward. So I hope that is what you wanted me to say, Greg.
I think you hit it, Jackie. Thank you so much. And the group that's steering this effort is 15 folks. We've got several of them here today. Jackie herself, Holly, as she mentioned, Michael, and Margaretta, if I've missed anybody else. And several of you may have gotten an email from me last night or this morning inviting you to help us out as advisors on this effort. We recognize we're probably going to have a fair amount of overlap because of, well, we got a usual suspect situation. A lot of you are involved in a lot of different things. So we are going to risk inefficiency to make sure that we are ineffective. So you may get many different messages from us. You'll see the thread between them. Just know that it's all connected, and we, again, are not trying to be perfectly efficient. We want to make sure we give you all lots of chances to contribute to this. There have been efforts going on historically. There are efforts underway right now that we need to know about and build upon. So our team is just 3 folks, and I'll give you quick overviews. Generally, think about me like the facilitator. Think about Laura as the main analyst, and think about Nancy as our system expert. Nancy's used to run Colorado's behavioral health system and is now a consultant, and we're happy to have her working with us. So today, what we want to do is give you all an overview of the assessment purpose and approach. We'll just do that in a couple of pages, answer any questions that you have. And then we'd like to use this, the second half, like a focus group to get your insights on system gaps, what opportunities you see, and then the available data that will help us actually size those gaps. When we think about something, you know, we know that there are many, many anecdotes in the behavioral health world. We know that there are data systems that are not always connected. And so we need to get our hands on as much data as possible so that we understand, is a gap the size of a bread box or the size of a box car, right? We will count on you all for that. So you are our first community group that we've engaged with. We couldn't be more excited, but that also means we still don't know all that much. So thanks for your patience. I'll go ahead and give you the purpose and approach, and then we'll get into the exercise. All right, I'll pause for questions after the purpose and approach. So we're looking at this as 2 phases. The first phase is really raw assessment. So between now and the end of the summer, call it September, we are looking to engage the community and get as much data as we can to make the case for change very, very apparent and have a shared future vision. The second thing we want to do is a good current state summary of your needs, your inventory of available assets and services, the issues that you see, the gaps, and then what all you think we could do at a high level to close those gaps. What are the most important things? This is the problem. I think we should do this. We're going to take that information, put it into a report on assets, gaps, issues, opportunities, et cetera, and then use that hopefully for a phase 2 that'll begin in the fall. And that's really about taking the assessment information and using it to chart the course forward. So based upon what we learn, we'll go through another round of facilitated activity to turn all of those opportunities and gaps into specific initiatives that address one or more of them, sequence those into a roadmap, and then underpin that with the financials, 5-year, 10-year. How much money is it going to take to get through the trough that always happens anytime you have a transformation, right? That can be used to engage the philanthropic community who have indicated their interest, but also are hoping for an integrated look at this and something that they can put their resources behind because they're going to see how it's going to get the island over the hump. We'll also include a summary of implementation challenges. We don't know at this point exactly who will be leading that effort, okay? Right now, we're just focused on phase 1. But one of the things we've asked that steering committee to do is give us their perspective on membership and decision-making, because this is discovery. When you start making decisions, we need to have potentially a different group of people at the table, okay? All right. So we've gone through introductions already. Let me tell you a little bit about what it is that we're doing. So we had our steering committee kickoff last week. So we're in this middle portion here. After doing interviews with all of them and a few other folks, we got them together. We talked with them about what do they envision for the future. And we don't have the words completely solidified just yet, but the themes are there. We're using those themes to help reach out in community focus groups like this one. I mentioned before, we need your help mining local data, and then we'll also be doing in parallel research and benchmarking. What are other communities like yours doing, finding, learning, piloting? We'll take that information and we'll do a whole bunch of frontline workshops to say, this is what we think we're hearing. Does that read right to you? This, what can we do about it? What do you know about from your experience? Okay, and then from that research and those workshops, we'll put it together to synthesize the findings. We'll get together with the steering committee at the end of August, potentially the first week of September, to share with them what we have found. So what you see is this is absolutely community informed. While we're pretty well grounded in the behavioral health space, we're not Nantucketers. We don't know your system the way that you all do. And so we need your help making those connections, understanding the specific issues in your community, and again, helping us put the data to it so that we're building toward a solution that we don't yet know, but we'll have the information that we can use to help build that. All right, I'm almost out of breath. That's a lot of words from me. What questions can you answer, or Margaretta, Holly, Michael, Jackie, anything else you'd add?
No, I think you said quite nicely.
Questions, anybody? All right, well, this is the part where I tell you that these are just blocks on a piece of paper, and we are going to be as flexible as we need to be. So if at any point in time you say, hey, look, have you thought about this? Because on this page doesn't show that we're planning a survey for providers and a survey for those who use the services on the island. There are probably a few other things that, in the interest of brevity, we haven't included, but there may be things that we're missing. So don't be shy, reach out, and we'll give you our contact information at the end. All right, we now want to use the time with you all, and let me ask a question to Kevin. Kevin, on your agenda, how many minutes do we need at the end for any kind of closing thoughts?
Kevin might have needed to pop off.
Yeah.
I'm not sure. So I think if we just have 5-10 minutes at the end, that's perfect.
Okay, cool. And the reason that I ask is because this is about to get interesting, right? We're gonna try to dump your brains out real fast, and there will be so much. I predict there's going to be a lot of momentum toward the end. So, all right, we'll try to leave at least 5 and hope for 10. Okie dokie. So here's what we're hoping to get from you all today. As you think about your behavioral health system of care, we'd like to understand your perspective along that entire continuum on a few questions. And when we say continuum, we mean prevention, intervention, treatment, and recovery. So we'd like to know from you what gaps and issues exist, what data or existing studies are available that can help us understand the scale, the magnitude of those things, again, box or boxcar. And then if you could change just one thing about the island's behavioral health system, what would it be? So in order to be able to get information from you all in an efficient fashion, we're going to use an online collaboration tool. It's called NoteApp. All right. Laura, would you be so kind as to drop the link into the chat? Actually, please don't, not yet. Stick with me, folks. I'm going to take you to NoteApp, and then I'll show you, and then we'll drop it in, and you all can do it with us. Did that successfully change over to my screen, my NoteApp? It did? Cool.
Yep.
So folks, what you're looking at is an online sticky note board. Okay. We have chalked the field. Let me show you a little bit about how this works, and then we're going to set you free to actually share your thoughts about the questions that we've asked. Okay. In the upper left-hand corner, you're going to see a little slider, right? That zooms you in and out. If you grab anywhere on the gray surface, which is the background, like hold down your left mouse key, slide left. I don't know how to do that on an Apple, but you all probably know how to translate that. Okay. You can see that we've set up the board here with the continuum: prevention, intervention, treatment, and recovery. So in each of those phases, we'd like to know, what gaps and issues do you perceive? What data or studies are available to help us size those? And if you could change one thing. So those are the 3 questions from the slide. All right, so let me show you how this works. If you tap your left mouse key anywhere on the gray, a note pops up. You can just type, okay? So, test for Greg. And you note it has some functionality here. It checked it. That's awesome. It'll correct your spelling. Don't worry about it. You can change the color of the note by tapping that button. If you realize that you've made a mistake and you just want to kill it, you can hit the delete button. If there's anything on it, it'll ask you, are you sure? And then the last thing that you can do is size the note using this lower left-hand corner. We're going to ask you all to put one thought on one note. Resist the temptation to write us an essay on one. If you put one thought on one note, it allows us then to move items around. Okay, so I can group 2 like items if you'll give them to us one on a note. All righty. That is about as much background as you need before you start messing with it yourself. You'll see again, the continuums on the top. The 3 questions are on the left-hand side. There's some guidance on that big yellow sticky. Laura, would you kindly drop that link into the chat? When you all click on that link, it's going to launch a new a browser window. You might have to navigate to that browser window to be able to enter. Don't hang out in Zoom because you're looking at my screen. But what I'll be able to see are all of the notes that you all are adding, and you'll see them too. There's a little bit of system latency, but it's pretty good. All right, so first things first, when you get your own window open, tap on the gray and just write a note that says, for instance, Sue. That way I know that Sue's in and that she's using the system. Okay, Sue, Tess, Michael, Brooke, Vince, Deb. All right. Okay, now try wiggling your notes around a little bit. Try resizing them and recoloring them.
Sorry, I can't seem to get a note up. This is Holly.
Hey, Holly.
I've been
are
Matt.
you in your own browser window?
Yeah, I'm in Safari.
Okay.
No, I'm on Zoom.
You need to go to Safari. Once you click on the link, go to Safari and find the Note app window.
Okay. Safari.
Holly, do you see the Zoom chat window?
Chat. That's how.
Yeah. Through chat.
The little chat button in the Zoom.
Yeah.
It says there's a link that Laura sent a few minutes ago.
Oh,
You
okay.
just click right on that. It'll take you to a whole separate
I
browser.
see. All right. Thank you.
I had the same problem.
Okay, cool. Thanks. Okay, now I'm in.
Okie doke. You all are seeing that this can get messy fast. Don't worry about it. Messy's okay. We can unwind it. What we're looking for is a volume of answers from you all. All right. So go ahead and delete your name note, and then help us out by answering the questions. All right. I'm going to begin, I think, by growing the cards here just a little bit to give you a little more room. But starting with prevention, what do you perceive as issues and gaps? You can either work side to side by starting then with intervention next, or you can go top to bottom, up to you. But we see those questions that you're answering. Okay. Good work, folks. You may have to move your notes around based on me changing the size of those. All right.
I'll add, if anybody's having trouble with Note app or if it's glitchy, feel free to use the Zoom chat window and I'm happy to transcribe anything you like.
Thanks, Laura. Do your best to make each note stand on its own, and do us the favor, if you're comfortable, adding your note or your name or initials on it. I've been using Sue so far, so Sue, if you'll just hit SM on it, if I don't understand it a week from now, I can just reach out to you, right? So thanks. All right.
Sorry, Greg, you want us to indicate our initials?
Yes, please, Michael.
Okay, thank you.
And Laura, I am having a little trouble trying to, if I want to do one under intervention, I can't seem to get over there.
Okay, so Margareta, if you click on the gray background and click and hold and then drag to the left, see if that will get you scooted over. And if not, just drop me a message in chat and I can do it.
Got it. Yep.
For you.
Okay, thank you.
Cool. Yeah, no problem.
Yeah, this is like at 10 minutes, you'll know all the tricks there are, but that first 10 minutes is sometimes a little uncomfortable. You can see we're getting a bunch of cluster, bunch of scatter there. If your note, for instance, corresponds to recovery, go ahead and drag it all the way over to the right. Or Laura, Nancy, and I can do that on your behalf. But your note may may look like it disappears. Remember that you can zoom in and out using that slider on the left-hand side.
So each idea, even if it has the same, is under the same category, goes on a different sticky?
Yes, please.
Okay.
I'm going to ask for a little more information on a few of these. So when you write school curriculum collaboration on what exactly? And similarly, Michael, thanks for adding your initials. Underfunded programs. Could you give us a list of ones that you think are, up there? I certainly know from our interviews that that's an issue, but where could we look? You guys are doing great here. I'm going to resize a few of your notes just to give you a little bit more room. The detail, folks. Thank you. If you're running out of ideas, feel free to ask other people what they meant when they wrote, or interact with each other as well. That's always very helpful to us because we get to hear a little bit more about how you think about it. Specialized licensed professions under treatment. Can you give us a list of what you think you have a sufficient number of, and what you think is missing? You know, and is it psychiatrists, child psychiatrists? It's, you know, whatever you say. Which free services do we need? That one's over here under prevention. If you can give us a little bit more detail. Again, we don't have to know everything today, but it'll give us better breadcrumbs to start looking.
Oh, my notes are moving around.
Yeah.
I don't know what's going on. Just, oh, are you editing my, somebody's editing my, I'm gonna start a new one. I don't understand what's going on.
Yeah, in some cases, we're just moving them where they belong. So if it's about treatment, we're moving it under the treatment.
I'm trying to type it. It keeps getting moved.
Sorry about that.
Mhm. Okay. Now I lost my thought. Okay.
Hey, Michael, on the difficulty I think it's used difficulty staffing crisis robustly. What exactly, is there a piece of the crisis response or pieces, or is it the whole thing?
Sure, I'll update it. And I don't know yet, so I'm thinking.
I won't move it around while you're thinking or typing.
Yep. It looks like you all have no shortage of ideas here. Reminder that we got 2 more questions for you. So again, as Laura described, if you'll find an open gray space, latch onto it with your mouse, and then move your mouse left and right, you'll be able to scroll down a little bit. The other 2 questions that we need your help with are what data or existing studies are available to help us size the gap. For instance, somebody wrote, historical data from crisis via BMH 24/7 ESPMC responses. Like, that's fabulous. Okay. And that's from Tess. Tess, we can, get your help making the connection to where that data will live. Okay, so thanks for that. And then the last one is if you could change just one thing. Okay, so that's all the way at the bottom. Give us the single thing. If you were boss for a day.
Oh, could you repeat that, please?
Yeah, sure, Holly. The third question is, if you could change just one thing about the island's behavioral health system, what would it be? Okay, and that belongs down here toward the bottom. Some of these are really excellent. They're just the way that you've described them. It's very clear to us, and we'll know how to proceed with investigating that a little bit more based on how you've written them. So thank you. And also really appreciate that you've gone all the way through the continuum, all the way out to recovery.
Well, like Greg mentioned earlier, we're excited to do a lot of community listening. So this exercise helps us get a volume of ideas all at once from all of you, sort of pick the collective brain trust. And our goal here for us is to do a lot of learning, theming, like Greg mentioned. If we see things that are showing up more times than not, or there's sort of a sequence of ideas that come together, it helps us really understand more deeply the specific ideas that you all see, the gaps you see. So thank you for doing that. Our job is going to be to absorb all of this and look for those themes, look for those areas where there's overlap, look for those ideas that you've shared with us and dig deeper into them. So you're doing a great job.
Excellent. Thanks for also answering your one thing note there. Yep, and I think think some of you may have just dragged down one of your notes. That's totally cool. We're not going to stand on the frame here. We're going to read for all of the themes. All right. Well, as Laura said, this is just our first touch. So this is a little bit different than many focus groups, but hopefully you'll see the wisdom early in an effort like this. We need to get a volume of ideas, something that we've learned in our time of working with stakeholder-led initiatives. Sometimes somebody speaks, they speak passionately about something, and another idea that's as good and has just as much passion behind it doesn't get heard because we have 20 people and we're doing what we do now, which is I speak, you all listen. And while that's really appropriate in certain settings, early in this process, we're going to have a few different meetings like this one, where we're going to ask you to dump out the brain, and we're looking for themes, patterns, etc., and as much information that we can then integrate and feed back to you to talk about what do we do about it, what details are we missing, etc. So thanks for your time today. We promised we would leave you 10 minutes toward the end. So with just a couple minutes left, do any of you all have any questions about our process or any other things you want to share with the group while we're here? All right, then Sue and Kevin, we'll turn it back over to you.
Okay, I was actually going to say, I think we have more time. We usually go till about 1:30.
Oh, I'm sorry. I had this only on my calendar as a 1 hour.
Which is, so it's up to you if you want to give more time, if you think people are still writing.
We do leave the board open. So
okay.
If you all just save that link as a favorite, you can go ahead and add notes in there. Do us one favor though, if you add a note later, because we're continually mining the board and reorganizing and things like that. If you add a note later, put some asterisks or stars or highlight something and hit Control B, it'll bold it that way, or use a funky color. That way we'll know that it's a late entrant. So if we do have a few more minutes, I'd like to use just a little bit of the time to talk about a few things here. Or actually, Nancy, I think, has a couple of items that she was looking for a little bit more information on as well. So I'm going to go first then. Can we talk a bit about recovery? So I see a note here. I think this is Sue. No reliable spaces for recovery meetings for any kind of group, eating disorders, sex, tech, substances, etc. There's just a lack of on-island recovery interventions, very limited medication-assisted treatment. So there's a lot of richness there. What has been your experience with that? And what would you add to Sue's note over here under recovery?
Do you want folks to type or speak up or?
Oh, speak. Let's speak now.
You read it one more time.
So I would say with the cost of real estate on Nantucket, space is always a limiting factor for being able to create and run new programs. Where will they live? Where will they meet? People are always chasing down meeting space. And so, I mean, it's a bit of a chicken and an egg thing. Somebody has a good idea. They even have someone to do it, and then they can't figure out where to do it. And then, of course, I always tack on the housing issue in terms of housing the people to do the work as an adjunct to the space question. So,
yeah, absolutely.
So on the crisis system, there was a comment about gathering information from DMH about crisis response. If someone has a contact at DMH, that would be helpful to either note or tell us about. And any data, I mean, we've got a few leads on data from the hospital and law enforcement to help quantify that need would be helpful, both on the thinking both about mental health crisis as well as substance use crisis, since the responses are slightly different. Thoughts about that?
Mhm.
Have there been any previous efforts that we should look at to understand what's been tried on the crisis response system? I see comments about better collaboration with the hospital, space, some suggestions about crisis stabilization units versus inpatient. Has there been any discussion that we should know about?
I'll just chime in historically that there's a ton of data between Fairwinds, the hospital, in the state around utilization, demographics, peak times, insurance coverage, and everybody has a piece of it, but no one's put it together comprehensively. But that would be really informative.
Okay, great. So it's those three sources are the primary sources.
Yeah.
Let's ask the same general question around housing. It comes up, and every community that features a heavy resort component has this issue. Similarly to Nancy's question about what do we know about it, what's already being done, I remember, and I can't recall which of you is part of a housing solutions effort. What's our best way not to have to reinvent that wheel, but to be able to understand sort of unit prices for different solutions, things you've tried that worked, but we needed $1 billion and we had $1 million. I mean, anything that is an existing analysis on housing?
So this is Brooke again, and yeah, we have a lot of information, and the municipal housing director Tucker Holland has a lot of information. But the bottom line is that we have a housing crisis that extends from the person making minimum wage, or by Nantucket standards, all the way up to people making $200,000 a year as a family or more. Our area median income is now $120,000. But our median home price is $2.5 million at the end of last year. So you cannot find a single family home on Nantucket for under $1 million now. They just don't exist. Or if you find one, it requires many $100,000 of renovation to become habitable. So what we're doing on the housing front is we're focused on meeting our state required housing units, which largely, for reasons I can explain to you in more detail and not bore everybody, focuses on rental units at the moment. But we have a need that is broad and deep, and we have a lot of ideas. And to your answer, we were given $25 million at town meeting 2 years ago, and it's gone. And there will be units created out of that, but a large amount of that money was spent buying land for future development as well, which requires more money. So it is a fundamentally, it boils down, in my mind, to a financial question and a commitment on the money front. And there's all kinds of restrictions around, you can't build housing for a specific group with municipal dollars. It has to be distributed through affirmative fair marketing. So we can talk more about that, the details of that.
Yeah, that's helpful, Brooke. I appreciate you making that connection, and we will start. We'll start with you on that one. Awesome.
And Greg, do you mind if I add something? I think it's important from some recent conversations I've had in the last few weeks. It's become very apparent that there's the question of what residents face in terms of a housing crisis, and then there's a question that the consortium of organizations might have a little bit more future control over, which is the availability of housing for staff. Both of those are obviously concurrent, but when I think of the potential future synergies that come out of this type of work, I think that there are you'll probably discover in your analysis existing resources and efforts focused on providing some sort of housing for specialized or just service organization staff. And I don't want to take away from what Brooke said, but what I think makes solution difficult, at least from my early quick perspective, is that pretty much everyone in the community is in some degree of housing, a crisis. And so distinguishing between, who needs it for this purpose and who needs it for that purpose and what the stressors are creates a problem that feels too large to be able to solve. But I do think that as you go into data and you start to talk to the advisors and those that are going to be in those focus groups, hopefully what will emerge are the culmination of efforts taken by many agencies to actually raise money and come up with solutions that together could deliver something in the shorter term.
That's super helpful, Michael. Thank you. All right. So appreciate your guys' help this morning. Nancy, Laura, and I each have an 11. As I mentioned, we only thought this was an hour session, so I apologize if we're rushed at all. But I know a number of you received an email from me last night inviting you to a data advisor meeting toward the end of the month. Thanks for filling out that doodle. If you all have other ideas or want to reach out to us, I'm going to flash up on the screen my contact details and Laura's, and you can reach out to us. Okay. So I'll actually, Laura, do you mind putting those in the chat?
Absolutely.
Thanks. Okay. So we're going to continue holding focus groups like this one. Then we need to follow the threads, right? So what's the data that helps us size those gaps and issues? We've got that kickoff meeting proposed with the advisors, and it says at the end of the month because we don't have the date yet, but we asked each of the steering committee folks to give us 1 or 2 people in their organization who have the numbers, right? Who have the details. So if in the next week or so, you think of any other information that would be helpful for stitching together the story, and again, adding the information so that it's not an anecdote, but a fact, that'll help us a lot. All right. So appreciate your time today. Very thankful to Kevin, Jackie for giving us the stage, and for you all for your ideas. We're in the very beginning stages, but we're looking forward to building momentum quickly. So thanks.
Thank you very much to all of you.
All right.
Perfect. If you guys don't have to stay for the rest of our meeting, but I think we're all really excited to see all the ideas that have come out so far. So thank you all. For the remaining gang, it's just time for future events if people have things going on that they want to share.
Thanks, everybody.
Thanks a lot.
Bye.
Brooke, go ahead. You can start.
Hi, everybody. The Nantucket Affordable Housing Trust is working with a Safe Place and Fairwinds, and we have scheduled a community forum on May 25th at 6 p.m. It will be a Zoom webinar format, live broadcast on YouTube and NCTV 18. And we don't have an official title yet, but it's the theme is the impact of our housing crisis on our community. And we are going to be sharing individual stories and some perceptions and data points from agencies that serve and folks that serve the community. on what's happening and how the housing crisis is impacting mental health and other issues for folks in the community. And so we encourage everyone to come and join that if you're able to. That evening, we'll be doing some publicity on it, and it will be available later for viewing on YouTube and translated, subtitled into Spanish and Portuguese after the fact. So we hope you'll come. And I think the trust feels really strongly that everybody knows there's a housing crisis, but really helping people understand that it's accelerating and that it needs our attention this year at town meeting in particular, because as I said earlier in my comments, we can't do it on Nantucket without money. And that is what town meeting is, the mechanism for allocating those funds. So thank you.
Thank you, Brooke. Does anyone else have any activities they want to invite us to? I know I can say that Janina Keene is going to be back next Friday for module 1 of her 4-part series. We've completed round 1 of the series, but we're repeating the first module again for Mental Health Awareness Month because it's on mental health and mental disorders. It's just sort of a deep dive into what different disorders look like and if they're, triggered, how they happen, what your brain looks like when you're diagnosed with something like schizophrenia or addiction, and sort of routes to treatment. And just so you know, we've always incorporated in the end of all of our slides, and we hand out the slides or email them now to all of our participants, and it has all the resources that are available on Nantucket for folks to access. So in fact, we should just start putting the Behavioral Health Advisory Group website on there as well. But we link to Fairwinds and Gosnold and Addiction Solutions. So I wanted you all to know that we're out there trying to make sure people know who you are too. And I know a lot of you have taken lawn signs for Mental Health Awareness Month, so I really appreciate that. Anyone else have any things to plug or items to share? All right, I think we're good and we're done early. That is our present to all of you. So in honor of Mental Health Awareness Month, take care of yourselves. And thank you for all the work you do.
Sue.
Thank you, Sue.
Thanks, Sue.
Welcome.
Hi, everybody.
Thank you, everybody.
See everybody.